One area of serious injury law that we practice commonly has to do with spinal cord injuries. And this, again, it can be of two different types. There's spinal cord injuries that occur because of trauma, and there's spinal cord injuries that are organic, part of the wear and tear of living in our human journey. So when you've got a trauma-based spinal cord injury, be mindful that there are varying types of traumas that can cause that. Oftentimes, it's a rear-end car wreck. Oftentimes, it may be where you've slipped on ice and fallen. But typically, there's forces involved that are having a significant impact on the spine. That can happen if you're young. It can happen if you're old. But the older you get and the more degeneration that occurs within the spine, the more likely it is that if you're in some level of trauma, you're going to have a potential problem. So how you as a person recognize it is you say, my back didn't hurt before, or my neck didn't hurt before and it hurts now. Why is it hurting? Well, if it's hurting because you just were involved in a wreck of some type, or you just had a fall, then the timing of it makes pretty good sense of why you're having the problem. Even if the beginning of that pain doesn't happen until the day after the trauma. Oftentimes, you'll wake up with it the next day. And when that happens, and you go in to get help from a healthcare provider about it, oftentimes, they're going to do an x-ray to see if a bone's broken. That's all an x-ray is going to show you, is whether a bone's broken. And then they'll either do a CAT scan or the more sophisticated test, the MRI. The MRI will actually be able to show the discs and what's happening as the discs relate to the spinal cord. So we have nerves that run up and down our spinal cord. Nerves that are in the upper part of our spinal cord go to the function of our arms and hands. Nerves that are in the lower part of the spinal cord will go down to into our legs. And if we begin to feel radiating pain from that area of pain that we're experiencing, let's say we've got low back pain following an accident and it begins to radiate into the leg, then that's a warning sign that there may be pressure on the nerve root of the spinal cord. Again, an important thing to know about. And an MRI, sometimes even a CAT scan, especially if they're done with contrast, with dye going through, it will be able to show whether you've got a nerve that's having pressure on it. Now, the doctors that do this kind of thing use fancy medical words, and one of them is stenosis. So they may do a MRI, and you may get a copy of a report, and it shows that you've got stenosis of the L5-S1 nerve root. And you're thinking, well, what's that? All that means is that you have pressure that's being placed on the spinal cord. And if it's enough pressure, it's going to cause serious pain. Now, you may have back pain or neck pain after an accident and not have a spinal cord injury. It may be from a muscle strain sprain that's going on, or even tears in the muscles, in the musculature around the spinal cord. But an MRI typically is going to tell the story on that. And if you've got what the doctors are describing as a herniated disc or stenosis within the discs, or even sometimes if they're sort of understating it, they'll call it bulging in the discs. These are serious problems that you need to have a conversation with your doctor about. They're serious because sometimes if it's a bad enough problem, and then if you get into another accident of some type, it can rupture that disc and you can end up with paralysis. So it's important to make sure that you're having good communication with your doctors about the imaging studies that need to be done to determine how significant the injury is and where it's at, and then good discussions about what do I do to take care of it. Most commonly with herniated discs or bulging discs or even some level of stenosis, doctors are going to suggest anti-inflammatory medicines. They're going to suggest physical therapy. They're going to suggest sometimes injections of steroids to try to help with the problem before they end up suggesting surgery. But even if they go to surgery, nowadays medical science has both minimally invasive surgeries that have less recovery time associated with it, and then there are more major surgeries where you might have to have a fusion or some type of major open surgery occurring that will lay you up for maybe 6 weeks. So that's the trauma-based part of back injuries.